All right, we are now on to chapter 2. This is the first chapter that actually has, medical terms to learn. So as we work through, I'm going to kind of orient you to how the chapter is laid out because every chapter that comes after this is going to be laid out in the exact same way. This chapter is a little bit of a hodgepodge just because it's not one particular body system, but it's going to orient you to the body structures, the different colors that are associated with medical conditions, and then it also lumps in oncology, which is the tumors and cancer related studies. So we're going to kind of dive into that. The first thing that every chapter is going to do is give you a very brief kind of anatomy lesson. It's one thing to know medical terms, but if you don't know, where to apply those terms in the body, then it's going to be a little bit difficult. So the very first part of every book is going to kind of go through a few tables that orient you to the key body parts you're working with. And this chapter just does a loose version for the whole body. So there's different levels of organization. So, your smallest basic unit of a living cell is the cell. Can't get much smaller than that. And then when you have a system of cells working together, then that becomes a tissue. And when you have a series of tissues working together, then that can make an organ, like a heart. And then when you have organs working together, then you can create a system, which in our case, it's either cardiovascular system, or it could be the body as a whole as a system. And I'm telling you this because there are going to be medical terms associated with these words as we move through. Can you think of the different types of tissues that you have in your body? Thinking about groups of cells that work together as a common function, what those different body tissues are. Think for a moment. The ones that we're going to focus on in this class are centered around 4 main areas. So muscle tissue, whose job is to provide movement. You can see muscle tissue as an example in the bottom right-hand corner. You can see the striations. For those of you who have taken anatomy and physiology, you are much more in tune to the specifics. Then we have nervous tissue. You can see these neurons here. They are responsible for coordinating our movement. Connective tissue is the third pictured here, and that is, the structural support for our different body structures. And then the last is epithelial tissue. So this is what we think of as our skin, but it also lines our body cavities and organs and things like that. So those are the 4 main areas we're going to focus on. There will be some medical terms that go with each one of them that we'll get to. All right. This book is going to cover different body systems. So I want you to take a minute and think about what your different body systems are. We're going to be focusing on 11. Can you think of 11? I'll give you some seconds to figure that out. Well, I'm hoping you came up with at least 5 or more. So here they are. There is a table in your book starting on page 19 that kind of goes through what the different body systems are and what their main job is, as well as the organs that, live inside that system. We have integumentary, so that's your skin, your hair, your nails. Respiratory, which, is responsible for giving you oxygen and getting rid of carbon dioxide. Urinary system, so obviously getting rid of the waste. Reproductive system, there is going to be a chapter dedicated to the male reproductive system and the female reproductive system. There's also a chapter dedicated to obstetrics, which is, pregnant women and their newborn babies. So I guess that could be lumped under, reproduction as well. Cardiovascular, so that's your heart and your blood vessels. Immune, so fighting diseases. Your lymphatic system, again, is also for fighting infection, also drainage. Digestive, self-explanatory, breaking down your food. Here, this book combines muscular and skeletal together into musculoskeletal, kind of as an overall structural support kind of thing. And then we have the nervous system and the endocrine system, which is that system of hormones that regulate your activities. Here's a good diagram to know. This is the different body cavities organized. So it's taken straight from, your book on page 20. Different organs live in different body cavities, and it's important when one doctor or nurse is talking to another that you are on the same page with organization of the body. So at the very top, you have the cranial cavity that holds your brain. Makes sense. Cranial means pertaining to the cranium or the skull. Then you have the spinal cavity, which is where your spinal cord lives in between your vertebrae. You have the thoracic cavity. The thoracic cavity is basically your thorax. Inside this cavity, it goes all the way down to this natural barrier. Think about what that might be. Hopefully you are saying that that is your diaphragm. But above that, you can think about what's above your diaphragm. This is what goes down when you breathe in and up when you breathe out. You have your heart and your lungs up here. And then down here, there's no natural space dividing these two areas. It's kind of a little bit more fluid. But there's the abdominal cavity, which has, your stomach, your intestines, kidneys, pancreas, things like that. And then if you go a little bit farther down, we have the pelvic cavity, which is where your pelvis bone is, or pelvic bone or pelvic area, your hips. And that's really where we consider the bladder and your reproductive organs, a little bit of the intestines and so on is down here. Again, there's no barrier, so sometimes we do refer to this as the abdominopelvic cavity, just kind of combining those together. So those are the different cavities of the body organization. You can see a little bit how it's labeled in bigger terms. We're going to learn body direction in chapter 3, but ventral means stomach. So all of these are on the, or front. All of these are on the front area, so that's why they're called ventral. Again, we'll learn this in chapter 3. Dorsal, like a dorsal fin on a shark, is on the back. So dorsal means back cavities, in this case, the cranial and spinal cavities. I've put together a couple of slides that, again, just say what I said. If you want to go back, you can look at them, of what organs are where. I'm not going to specifically test you on this, but it's just a good idea to understand where different things are. All right, so that's body organization, and now we're getting to our very first slide of medical terms. In this case, we're going to look at body structure. A lot of those key terms that I went over that are anatomy related, we now have a medical term for. You're going to notice that all of these are in the combining form version. So they have the word root, and then they have the slash, and then they have the O. This is going to be the way that you write everything for the most part in the book, on the test, unless I specifically tell you otherwise, but usually you're going to see the words combining form. So I'm going to go through these, and then what I would recommend is pause the PowerPoint, take a break, and work on these exercises before you move on. Throughout the PowerPoints, I always kind of put what exercise these words go with, and if it's helpful, kind of work through, listen, then do the exercise. Listen some more, then do the exercise. This table of words you're going to be able to find on page 22 of your book. And adeno is gland. So it's not a very specific term. You have lots of glands in your body, but that's what it means, adeno. Cyto, like cytoplasm, for example. Cyto means cell. So if you're talking about that cellular level of organization or a specific cell, cyto. Epithelio, take a guess, means epithelium. When in doubt, it's basically the first part of the definition. So if you have no idea what the medical term is, just kind of use the first part of the word and hope for the best. Fibro means a fiber. Oftentimes that's used to talk about, muscle fibers, for example, or a rough fibrous growth. Histo means tissue, so that tissue level of organization. Histology is the study of tissues, so if you want to be a histologist where you get to kind of look at tissue slides all day, that might be something for you. Karyo means nucleus. So karyo are, for example, cells that have a nucleus, which is why there are prokaryotes and eukaryotes. Thinking back to biology once upon a time, pro meaning before, so before nucleus, and then eukaryote, eu means a true or has one. Thinking of how those connect. Lipo, or lipo, you could say it either way, means fat. So liposuction is always the one that I can easily think of. But there can be growths and things like that. Myo means muscle. Neuro means nerve. I feel like those are common. Organo means organ. Not all of them are crazy hard and don't look like the word they mean. That one's pretty straightforward. Sarco. Sarco in your book says that it means flesh or connective tissue. Please do not use flesh. The anatomy and physiology teacher will also not want you to use flesh. It means connective tissue. So if you have a sarcoma or something else, then we'll see that a little bit later if there's a problem with your connective tissue. Systemo means system, whether it's a body system or your entire body is a system. And viscero, that's pronounced viscero, that means your internal organs. So your viscera are all of your internal organs put together. So I would recommend taking a break. You can work on the exercises just to at least get the words down once if that's helpful before moving on. Here's an example of one of the exercises in the book, seeing if you can take the word and come up with the combining form. So think about what that might be. Cell, cyto, C-Y-T/O. I'm going to keep reiterating it is important that you spell these correctly. You will be graded for spelling on the exam. Tissue is histo, and then a group of tissues working together is an organ, so organo. And then a group of organs working together is a system, so systemo. Type of tissues, we have our nerve, so that would be neuro. Epithelium tissue is epithelio. You shouldn't have any trouble spelling it because it's spelled pretty much the same way as epithelium, so use that as a guide. Connective tissue, sarco. And finally we have muscle. So that is going to be myo. All right, moving forward, the book likes to get out all of the combining forms first, and then it's going to do the prefixes and suffixes and other things along the way. It always gives you the pieces first before we start to build large words also. So here we have the body structure terms. And as you'll find, there's going to be multiple terms that mean similar things. So if that's true, you'll see them next to each other in the table in the book, or in this case, next to each other here. So we have cancero and carcino. Both of them mean cancer. So I can think of like cancerous or carcinogen, are words that we're going to end up figuring out what they mean. For your purposes, you're just learning. You can kind of use them interchangeably and still be accurate. In common practice, certain circumstances, you would use one or the other, but I would not mark you down if carcinous instead of cancerous, for example, because you at least have the piece that means the right thing. Etio means the cause of, like an etiology would be what is the cause of the disease. If you're thinking about like an outbreak that happened and you're trying to figure out what caused it. The next one is know. The G is silent, like in gnome, but know means know, to know something, knowledge. If you think of words like diagnosis, prognosis, that no piece is hidden in the middle there. Iatro is how you say this next one here, iatro, and that means a physician or medicine. It also has to do with treatment. I think of things like psychiatry, that's kind of hidden in the middle there. Leo means smooth. So we'll see things like smooth muscle and striated muscle. We'll see that there. Onco, as I've mentioned previously, means a tumor or a mass. It doesn't necessarily mean cancerous, but that's what it's usually associated with. Patho means disease. So like a pathologist is a person who studies disease. Rhabdo. Please note the weird spelling of this because you will have to spell this. R-H-A-B-D-O, rhabdo, means striated. So you can have smooth muscle or striated muscle. And then the last one, somato. Somato means body. So if it's associated with your body, then you could use this. It's kind of the opposite of psycho or psychological, which would be mind associated. If you want to take a break for a moment, work on exercise 6 and then come back. Okay, once we move past that, we are now on to the colors. So different medical conditions are associated with different colors. The first of which is chloro. I always think of chlorophyll from plants, which is green, which is why chloro is green. Chromo is the generic word for word part for color. So chromo, like monochromatic, means seeing one color. It means color. Cyano, if you had the big box of crayons, then cyan you would know is blue. If you have cyanosis, then that means like when you're really cold, your fingers might turn blue. Urethro is how you say this one. Again, weird spelling. Urethro. I always think of a erythrocyte, which you might know is a red blood cell. So urethro means red. Just like leukocytes are the white blood cells, so leuko, like it means white. Melano or melano, either one is equally acceptable, means black. So a lot of times you might have heard of someone getting a melanoma, which is a black growth on the skin. It's a kind of skin cancer. And then the last one is xantho. The X is pronounced as a Z, and that would be yellow. So these are all the different color terms that we're going to have associated throughout the entire book. Okay, almost to the big words. We have a whole bunch of prefixes and suffixes to kind of go through, and then once you have those down, then you can build the words for it. I will also say that everything we've covered up to this point should be in your flashcards if you did get them. Dia is the first. That means through or complete. So like a diagnosis means a thorough or complete knowledge of what it is that you have. Dis means usually like dysfunctional, means that it's not working or abnormal. It can also be painful or difficult. So if you're having trouble breathing or if something movement you're having is very painful. Hyper means above or excessive. So if something is working too hard or too much. Whereas hypo means that it's not working enough or it's under or deficient in some way. Meta means after or beyond or change. I'm trying to think of the best word in cancer context would be metastasis or metastasize. If a cancer has moved from one place to another, then it is at that point beyond control, which is why they use meta for that. Neo is new. So like a neonate is a newborn baby. A neoplasm is a new growth that might happen. And pro means before. Like I mentioned earlier, prokaryote means before a nucleus. All right, I'm sorry to say there are a million suffixes that they introduce you to here, but these are the same ones that we're going to be using throughout the whole textbook. So as we move through, you're going to see these same ones over and over and over again, so it'll get a little bit easier. Leading off, you'll see that there are 3 endings here, AL, IC, and OUS. All of them mean the same thing, and throughout the book we'll find a couple more that also mean this. It means pertaining to. So if I said cancerous, it would mean pertaining to cancer. If I said hepatic, pertaining to the liver. If I said renal, pertaining to the kidney. Those all mean having to do with whatever it's stuck with. Cyte, C-Y-T-E, means cell. We also saw cyto previously, but there's a suffix version as well. It just kind of depends on what word you need to make. We have gen and genic. They can get pretty confusing, so you need to kind of keep them straight. Gen is a substance that causes cancer. So it's kind of that physical thing that causes cancer. Genic means that it is producing or causing cancer. So the gen is the substance. Genic means causing or producing cancer. An example would be cigarettes are carcinogens. They are substances that can cause cancer. Now, smoking cigarettes is carcinogenic. That action can cause cancer, that thing. I'm trying to think. Asbestos is a carcinogen. Inhaling asbestos would be carcinogenic. Next we have logist and logi. So logist is a person who studies something, where logi would be the area of study. So a biologist would study biology. Megaly, you see that there's mega in there. I always think mega is huge. Megaly means that it is an enlargement of some kind. Oid means that it looks like something or resembles it. So a fibroid, for example, would be resembling or looking like fibers. Oma, we're going to see a lot. It means tumor. It doesn't, again, necessarily mean cancerous, but that's oftentimes what it's associated with. Osis, we saw before, means abnormal condition. So there's, something wrong with whatever it is. Pathy means disease. It's kind of a generic term, but it means disease of whatever you're talking. Plasia, there's a lot of suffixes we will find that look similar to this, and that's why spelling is going to be so important. This plasia means growth or formation or development. Oftentimes it's put together with hyper or hypo. So for example, if you have hyperplasia, you have overdevelopment of something. If you have hypoplasia, you have underdevelopment of something. Plasm means a substance or a growth. So neoplasm would be a new growth. I often think of cytoplasm from biology and cells. It's the substance within the cell. Here we next have sarcoma. Sarcoma is a weird one because it kind of combines some things already, but a sarcoma is a malignant tumor. A malignant tumor, meaning that it's, a cancerous form of the tumor. Oma, just a tumor. Sarcoma means a malignant tumor. So an oma can turn into a sarcoma if it gets worse. The last two, SIS means a state of. So it might not necessarily be an abnormal condition or a disease, but it's some kind of state that you're in. And then stasis. Stasis means controlled or stopped or standing still. So that's when we see words like metastasis, meaning that the cancer is now beyond control or beyond stopped. I totally recommend stopping at this point and take a break and work through some of the exercises to get these word parts down. It's going to make putting the larger words together so much easier. Just comparing and contrasting here, we do have, as I mentioned, a couple of word roots that have suffixes with pretty much the same meaning. Totally fine. It just depends on what word you're making. Sometimes you need a suffix to mean a certain thing. Sometimes you need the word root. So they're kind of can be used interchangeably depending on what you want to hook it up with for the rest of the word. As I mentioned, gen and genic are two most often confused suffixes. The gen is the physical substance, like a carcinogen, and genic is more of the action. It is the thing, carcinogenic, something that is producing cells. A review question: which of the following suffixes means disease? Well, hopefully you can at least narrow it to B and C. Both of those mean disease, but B is the correct answer because B is the suffix, whereas C means disease, but it's a word root instead. Once you get past all of the word parts, so we have done combining forms, we've done prefixes, we've done suffixes. It then finally begins to put them all together as full medical terms to define. And all of the chapters kind of break down in the same way. It's always going to start with your diseases and disorders, so it kind of groups those together. Then it's going to have tables for surgical terms, your surgical procedures, your surgical equipment, that kind of thing. We don't have that in this chapter, but we'll start to see that coming chapter 4. Then there's going to be diagnostic things, so that would be scans, those types of things are going to be in that category. And then we're going to get complementary terms, and those are ones that are used with diseases and disorders. I'll explain it a little bit more when we get there. But that's kind of the key categories that we're going to find in every chapter as we move through the book. Within that, they separate all of the ones from word parts, what I call the easy ones, and the ones not from word parts, what I think are going to be the more difficult ones. So let's dive in. So, starting with diseases and disorders, again, see how it says you have to also pronounce and spell these terms. Your book does give you a pronunciation key to kind of help you understand and pronounce these words. I realize that it might seem like kindergarten style with your pronunciation, but it's there to help you to say the words correctly. This table is in your book somewhere to kind of help you as well. You might need to flag it down as a reference. But the idea is if you see in the pronunciation macron or a long line above the vowel, then that means it has the long sound. It says its name. So like donate, you hear the O, you hear the A. If it doesn't have that above the vowel, then that means it's a short vowel sound. And then there's a little key there, like med-I-col. The I is not, it's not med-I-col, it's med-I-col. It's a short vowel sound. And then at the bottom, putting it all together, if something is in all caps, then that means it gets, you know, the extra emphasis on the word. If it's italicized, then that means that it gets a little bit of emphasis, but not quite as much. You can see this in words like all together, the geth part is the most emphasized, or pancreatitis, the tie part is the most emphasized. Seems silly, but it's going to help you pronounce. And just to get an understanding of how difficult it can be, you know, and how hard English is, you can see, for example, all of these OUGH words are all pronounced differently. We have bow, borrow, cough, enough, through, though, ought, hiccup. It's just crazy. Okay, what you've been coming for. So on page 29 is the first table of all of these terms. And you might be looking at this going, oh my God, I now have a whole nother list of words. But what I want you to see here is that all of these, because the top says from word parts, are built from those pieces that we already covered. So as long as you memorize the pieces that we've already covered, you're good. You can put them together in many different ways. So for example, adenocarcinoma. I know that means a tumor. Oma means tumor. Of the gland, and then in this case, cancer. So this would be a cancerous tumor of the gland. Whoop. Whereas an adenoma would just be a tumor of the gland. A carcinoma would be a cancerous tumor. So some of these you can kind of just go straight from front to end. Like a chloroma, it would be a tumor of green, or you would just say green tumor. Some of them aren't very intuitive. But understand that pretty much almost all of these end in oma. So as long as you know that what that means, then you're in good shape. We can also have something like a leiomyosarcoma. So sarcoma means a malignant tumor of the smooth muscle. Or you could have a rhabdomyosarcoma, a malignant tumor of the striated muscle. In this case, sarcoma you see here as its own word. It means a tumor of connective tissue. But remember, sarcoma can also mean, as a suffix, a malignant tumor. It gets a little tricky. But please know these are all built from pieces you've already learned. There are abbreviations associated with some words, and you'll see them throughout the tables. At the end of your chapter textbook, there's a table of all the abbreviations. You will be responsible for knowing those. I would recommend taking a break and looking at exercise 14 and 15. Exercise 15 is going to be very similar to certain things that you would see on the test, where you just have to be given a definition and you go about actually writing in what the pieces would be. Something like this. So you have neoplasm. It looks like a prefix and a suffix put together. But this is one of those silly things, which is why you might see in certain cases this, where the suffix has a word root built into it. This is pretty rare, but being able to take the word and break it down into its pieces correctly is important. Like that. All right, so just a quick review, which one of those is actually split up correctly? When you're writing these in answers, it's important that you put the right letters in the right spot. If not, you might be marked down slightly. In this case, A is the better answer because it has the slash around the O on both sides. Okay, so looking at this picture, it's a benign cancer. We haven't gotten to that term yet, but benign is the good kind, non-cancerous, or non-spreading in this case. And this is an example of a fat tumor. So ask yourself, what means tumor? hopefully you're coming up with oma, and then fat, lipo. So lipoma. Again, you get rid of that O combining vowel because the suffix oma already starts with a vowel. All right. Now we're going to get to the body structure terms. There's a lot, but again, I don't want you to freak out because all of these are built from word parts. So as long as you know the pieces from the beginning of the chapter, and all of those pieces are on flashcards, you can put all these words together. That's kind of the whole point, is that if you know pieces, you add different prefixes and suffixes, you can make so many new words. So for example, we have cytogenic, so producing cells, whereas cytoid means resembling a cell, or studying cells, or the substance in a cell. All of these start with the same word root, but have different suffixes on them. There's different kinds of growth. Plasia means growth. There's difficult or painful growth and development. There's excessive. There's not enough. Notice how, again, as I mentioned previously when we were doing colors, erythrocyte are your red blood cells, RBCs, and your leukocytes are your white blood cells. Otherwise, without going through each one of these specifically, work on exercise 19 just to get some more practice. These are not new terms that we've learned. They are all from the pieces that we started with. So here's an example of the excessive development piece. You have the adrenal gland on the left that looks normal. It's supposed to look like a little Hershey kiss on top of your kidney there. But on the right side, it's too big. It's been excessively developing. So thinking about what term that would be, excessive hyper, development plasia, make sure we're spelling correctly. Hyperplasia would be the term you put together. Okay. Another weird thing is we have what's called an ellipsis. And that's where part of the word is implied but not explicitly put in the word that you're writing. So, for example, erythrocyte. I mentioned it means red blood cell. But the word part that means blood is not actually in there. Erythrocyte literally translates to red cell, and leukocyte literally translates to white cell. But it's implied that it means the blood cells. So sometimes we take out those pieces to make the words easier to say. All right, which one of these words means a cell with a nucleus? Hopefully, we have arrived at A. Karyo means nucleus. So a karyocyte is a cell with a nucleus. All right, moving forward. There are no surgical terms, so we kind of skipped that area of context. There are no diagnostic terms, so we've skipped that for this chapter. And so we're going to complementary terms. And you're probably asking yourself, what is a complementary term? This covers signs, symptoms. This is also where they loop in all the medical specialties and the specialists and other related words. But most people don't actually know the difference between a sign and a symptom. The sign is something objective. It's what you see as a doctor when you go to examine a patient. It's what you observe. So in this case, in the picture, we have cyanosis of the nail. So cyanosis means abnormal condition of blue. As you can see in the picture, kind of. His nails are blue and his fingers kind of blue. A symptom is more of the subjective information. It's what the patient is saying about themselves. So they might be in the exam room saying, oh man, I feel a pain in my chest when walking. And it's kind of hard to measure that, right? You don't know what pain feels like to them. You have the chart of on a scale of 1 to 10, what is your pain level? But those are symptoms. It's what they're saying about themselves. It's not necessarily something that you can see. Okay, so here they are. In terms of your book, they are located on page 38. Looking through, these are still all built from word parts. Nothing new here. We're just putting them together in different ways to get new meanings. So, for example, cancerous means pertaining to cancer. Some of these words I've kind of used as examples throughout. Diagnosis is abbreviated DX. That means a state of complete knowledge. When you think about what that means in like real life terms, your diagnosis is when you actually understand what you're, being come down with or what you're sick with, what the disease is. That's the diagnosis. That's a little different than prognosis. Prognosis is the state of before knowledge. And usually what that means is that's your prediction. Because you don't know exactly what's going to happen, but someone's prognosis is what you are predicting before it actually happens. And usually that's given in the context of certain, deadly diseases. If they say, oh, your prognosis is 3 to 5 months, for example, that's the prediction of how long you might live with that condition. Other things, organic, pertaining to the organ, not specific foods that have not been treated. Metastasis and metastasis can be said equally correct. When you have more than one, you say metastases, and it's abbreviated METS. Otherwise, you can kind of work through all of these because they are built from word parts. In exercise 23, I would recommend doing so. Here's an example picture of what metastasis looks like. So normally what happens is you get some kind of tumor or growth, and it's growing in a set of tissues, and eventually it makes its way to a blood vessel. And if those cancer cells hop in the blood vessel, then really they can travel anywhere in the body. And so sometimes they end up popping out in a new location. And if they then grow and divide in that new area, then it is said that the cancer has metastasized or moved to a new location. That doesn't mean you have a new type of cancer. Whatever cancer you have is where the tumor originated from. So for our little diagram person here, it looks like she had a carcinoma in her lymph nodes, so she might have had some kind of lymphatic cancer, and it has metastasized to the brain, so it has spread to the brain. She doesn't have brain cancer. She had, lymphatic cancer that then spread. All right. Here's a little breakdown of how we use that word. Metastasis or metastasis is singular. Metastases is plural. If you say it's metastatic cancer, then that means that's the adjective version, and metastasize is the verb. Pretty crazy, but we can take any term and turn it into multiple forms of speech. All right, we finally get to the not so nice words. As you'll notice at the top, these are not built from word parts. So everything up to this point, as I have mentioned, has been made from word parts and is in your flashcards. Everything that is not built from word parts is not in your flashcards. If that is something that helps you, you will then need to make flashcards. You cannot rely on those word parts to help you identify what these words mean. These are the ones that you're just going to kind of straight up need to memorize. So we're going to start with afebrile, which means without a fever. So the A prefix means not. So that part I guess you can use to kind of break down the word, but it means without a fever. Apoptosis, hopefully from your science life, you might know that that means apoptosis, cell death, programmed cell death. Benign, we saw a couple of slides ago, that means non-malignant. You can still have a tumor, but it means that it's kind of non-cancerous, and hopefully that's the kind that you can just remove and be cured of cancer. Biological therapy is also called biotherapy, immunotherapy is usually what I would call it. But that's where they use immune system drugs, kind of, to help fight cancer. Carcinoma in situ. In situ means that it's kind of contained. So if a carcinoma in situ means that it's in an early stage. You have cancer, but it's still in an early stage and it hasn't spread or invaded any surrounding tissues. At that point, it's still contained. Chemotherapy, also called chemo, is when you use drugs to treat cancer. So those are drugs specifically designed to target cancer cells, whereas more of the biological therapy was specific to the immune system. There is a little bit of overlap there. Encapsulated means that it is closed within a capsule. Really what that means is that if you have a cancer in an organ, it's still, trapped in that organ. It hasn't spread somewhere else. Exacerbation, that's an SAT word. It means that it gets worse. So if your condition is exacerbated, it is getting worse in severity, or your symptoms are getting worse. If afebrile means without a fever, then febrile means that you have a fever. Hospice. Hospice is kind of that place where someone can receive supportive care. It's where you think of it as elderly patients go to die. It's where at that point there's nothing that anyone can do besides make you feel comfortable for the patient and the family before that patient dies, and that's what hospice is. Idiopathic. That one does kind of look like a translate from word parts. It's pertaining to a disease of unknown origin. So the idio kind of means unknown origin. And it could be, you have an outbreak or just someone with symptoms and you're not really sure where they're coming from yet. Inflammation, I'm going to assume you know what that means. In vitro and in vivo. In vitro basically means in a test tube. It's not in the body. It's in a lab somewhere. So I always think of in vitro fertilization, where you get those test tube babies, for example. In vivo means inside the body. So whatever it is that's happening is actually in a person. Malignant is the bad kind, means that it's tending to progressively get worse. The next two words, morbidity and mortality, go together. Morbidity is kind of the state of being diseased, but it's a measure of the population that's diseased. So if you'd say that the particular illness has an 80% morbidity rate, then that means that in a given population, 80% would get sick. Mortality is the rate of death. So it's one thing to get sick, but then it's, an entirely new level to die. So if this disease have an 80% morbidity and maybe a 30% mortality, meaning that all the people that get sick, that percentage actually die from that sickness. Palliative is the type of care that you would receive in hospice, where they give you relief, but it's not a cure. They can't cure you at that point. Radiation therapy is abbreviated XRT because it's X-ray radiation therapy. It's kind of oftentimes either used in place of or in combination with chemotherapy. It's where they use X-ray radiation to zap specific tumors. And then finally, remission. Remission is where the signs of the cancer are now gone. And if a person has cancer and they, do rounds of chemo or radiation or whatever and a cancer goes away, then that person would be in remission. And I think after so many years of remission, then technically you're cured of the cancer, although I'm not exactly sure how long that is. That was a lot. Take a break. Look at exercise 27, 28. Matching, where you can kind of put together these words with their definitions. Here's a picture representation of kind of the progression of a cancer situation. So on the left, you have the normal. Those cells might still be normal, but they start to kind of grow out of control. That's when we have hyperplasia for excessive development. Something happens, some of those cells become irregular or non-functional, so then you get dysplasia, so you get kind of painful or difficult growth. Some of those cells might turn cancerous, but haven't spread yet, so then you have carcinoma in situ. And then if those cells then might start to invade surrounding areas, then you have a full-fledged carcinoma, just to kind of give you an idea of how that progresses. Okay, which of these is built from word parts? And you can figure out its meaning. They all kind of look Latin, but you can't use that as the guide. The correct answer is C, adenocarcinoma, cancerous tumor of the gland. The others are technically not built from word parts. All right, so towards the end of this chapter, I'm not going to specifically test you on this, but there is a table just to help you figure out how you would say a singular version versus a plural version. For example, a vertebra, multiple of that would be a vertebrae. Thorax versus thoraces, although I don't know why you would ever be talking about multiple thoraces. Testis versus testes, and so on. The table continues in your book on page 48 if you want to kind of look through at least once just to get an idea of how we do that. All right, very end of the chapter, you will find abbreviations in your book, in your case on page 50. Most of the time we're going to use abbreviations as much as we can, speaking and writing in terms of medical speak. Some of them have to be used in context. For example, it seems silly, but shortness of breath means SOB, which might be misinterpreted by a family if overheard incorrectly. And healthcare employees, you might find certain hospitals have different abbreviations that they've just kind of come up with, just like you in your note-taking might have little abbreviations for things that other people might not know what that is. Here are the ones that are for this chapter. I tried to highlight them as much as possible as we were working through the chapter, but you can kind of see what they are. Carcinoma, chemotherapy, DX, diagnosis, PX is prognosis, and so on. So there is an exercise at the end of the chapter that kind of goes through those abbreviations. All right, what's happening in this picture? What type of cancer treatment is this? You'll notice that the nurse is giving an injection to the patient. This would be the delivery of drugs meant to fight the cancer, so this would be chemotherapy, or chemo for short. This would be what radiation therapy looks like. You use a high X-ray beam to zap a particular area of the body, and that would be XRT for the radiation therapy. Okay, at the very final point of the chapter, there are clinical contexts. I think they're really helpful to kind of tie it all together. That's where you can kind of read through a situation where it's using a lot of the terms that you've been exposed to in the chapter, and it has the pronunciation piece and gives you a better understanding of what's happening. There's also some true-false questions here. from the medical document to kind of give you a clue as to what's happening. Those same types of questions are also located in your book in the exercise chapter. At the end of the chapter, you will also find a little quiz with multiple choice that will help you review as well. And to be clear, the end of the book has all of the answers from every activity in every chapter. So looking at your book right now, Appendix A, starting on page 669 of your textbook, it does have the answers. Just because yours doesn't match up exactly sometimes doesn't necessarily mean it's wrong if you picked a word that means the same thing. But it'll give you an idea. It tells you the answers to the multiple choice quizzes to let you know you're on the right track. And that is the end of chapter 2. Okay,